The World Health Organization, who has declared Mpox, formerly known as monkeypox, a public health emergency of international concern due to the surging cases in the Democratic Republic of Congo (DRC) and the emergence of cases in neighboring African countries that have never reported Mpox before. The WHO's Emergency Committee Chair, Dr. Dimie Ogoina, emphasized the weaknesses in the surveillance system, suggesting that the current cases might be just the tip of the iceberg. The Director General of WHO, Tedros Adhanom Ghebreyesus, expressed global concern and called for aggressive action. The Africa Centers for Disease Control and Prevention (Africa CDC) has also declared Mpox an emergency, marking a proactive stance against the virus. In the DRC, children are the most affected, accounting for the majority of the 14,000 cases and 511 deaths reported in 2024. The numbers are comparable to the total cases reported in the country last year, and significantly higher than those in 2022. The Africa CDC Director General, Dr. Jean Kaseya, highlighted the need for international support and expressed concern about the high percentage of cases in children under 18. Attributing this to a lack of smallpox vaccine protection and malnutrition. In the Democratic Republic of Congo (DRC), the situation regarding Mpox is critical. As of the information provided, there have been 14,000 reported cases of Mpox and 511 deaths in 2024. This indicates a significant increase compared to the total cases reported in the country for the entirety of the previous year, and a substantial rise from the numbers reported in 2022. Children make up the majority of these cases, which is a major concern as they are particularly vulnerable due to a lack of protection from the smallpox vaccine and high rates of malnutrition in the region. The fatality rate among children is particularly alarming, with about 70% of the cases occurring in children under 18. The clade IB variant of Mpox presents several challenges in both detection and treatment. 1. Diagnostic difficulties. Due to a genetic change in the virus, the clade IB variant is harder for diagnostic tests to detect. This makes it challenging for healthcare providers to accurately identify and diagnose Mpox infections, potentially leading to delays in treatment and the implementation of control measures. 2. Novel transmission route. The clade IB variant is the first to be spread through sexual transmission. This new mode of transmission requires a shift in public health strategies and education to effectively target prevention and control efforts. It also broadens the potential risk groups and settings where the virus can spread. 3. Vaccine accessibility and affordability. While vaccines are an important tool in controlling the spread of Mpox, there is a significant disparity between the need for vaccines and their availability in affected regions. The cost of the vaccine is also prohibitive for many countries in Africa, with doses priced at around $100 each, which is unaffordable for many nations dealing with the outbreak. 4. Limited understanding. As this variant is relatively new, scientists are still learning about its characteristics and behavior. This includes understanding how it differs from other clades in terms of virulence, transmission dynamics, and potential responses to treatment and vaccination. 5. Resource constraints. In addition to vaccine availability, there may be shortages of other critical resources needed to manage the outbreak, such as personal protective equipment (PPE), antivirals, and other medical supplies necessary for treating infected individuals and protecting healthcare workers. 6. Surveillance and response. The weaknesses in the surveillance system, as mentioned by Dr. Dimie Ogoina, can hinder the early detection and rapid response to the outbreak. Improving surveillance is crucial for identifying cases, tracking the spread of the virus, and implementing targeted interventions. Addressing these challenges requires a multifaceted approach, including enhancing diagnostic capabilities, improving access to vaccines and treatments, increasing awareness and education about the virus, and strengthening surveillance and public health infrastructure. The US has also expressed concern and has pledged nearly $424 million to aid the ongoing crisis in the DRC, with an additional $10 million for Mpox response and 50,000 vaccine doses. However, Africa CDC points out that the need for vaccines far exceeds the current supply, and affordability is a significant issue, with the vaccine priced at around $100 per dose. The Mpox variant spreading in the DRC and neighboring countries is clade IB, which has presented challenges due to its genetic change, making it harder to detect and being the first to be spread through sexual transmission. Despite these challenges, this variant appears to be less fatal than the original clade I, with a fatality rate below 1%. In summary, the global health community is facing a significant challenge with the mumps outbreak, particularly in the DRC and other African countries. The WHO and Africa CDC have called for urgent, proactive, and aggressive action to address the emergency. The international community, including the US, has pledged support, but the need for vaccines and resources far outstrips the current supply. The outbreak is a wake-up call for the world to take urgent action against mumps. Don't miss out on the latest trending news. Subscribe now to get real-time updates delivered straight to your feed. Hit the bell icon to never miss a story. And if you enjoyed this update, give us a thumbs up. Your support helps us bring you more of the news that matters. I remain Kelly Natty of Rapid Trend News.